Every day with depression was a struggle. Day after day, I put up a good fight, but my antidepressant medication could only take me so far. Now, I'm a NeuroStar.
NeuroStar is an innovative FDA-cleared therapy for depression. Remission was observed in a 6-week clinical trial. It helps activate the natural function of the brain's neurotransmitters using a non-invasive magnetic field. NeuroStar should not be used in patients with certain metal or devices in or around the head. NeuroStar is not a drug, and it's not ECT. It's an easy in-office experience. You're awake during treatment. No effects on memory or sleep were identified in a 6-week clinical trial, and it's covered by most health plans. The most common side effect is temporary pain or discomfort at or near the treatment site. There is a rare risk of seizure. Talk to your doctor if you have worsening depression, suicidal thoughts, or actions.
Become a NeuroStar. Visit NeuroStar.com. Talk to a doctor to see if NeuroStar is right for you.
NeuroStar TMS therapy. Remission from depression is possible. Severe depression is a serious illness that affects approximately 350 million people worldwide. According to the World Health Organization, depression is the leading cause of disability. Although medications can help manage depression symptoms, adequate treatment is difficult to achieve in most patients with standard drug therapy due to lack of efficacy or intolerable side effects. Many patients seek different treatment options in order to relieve their depression, but the likelihood of achieving remission declines with each subsequent treatment. So patients are more likely to discontinue treatment. Patients with depression who are not benefiting from their current antidepressant medication need a different approach to achieve remission. NeuroStar TMS therapy, the first FDA-cleared TMS treatment for depression. Backed by the largest TMS clinical data set, 6 studies with 800 patients. NeuroStar also has CE mark approval and is available internationally. TMS, or Transcranial Magnetic Stimulation, uses targeted magnetic fields to treat major depressive disorder. NeuroStar TMS therapy is a proven, safe, and effective treatment option for patients with major depressive disorder. The NeuroStar system consists of a mobile console that houses the power electronics and interfaces with a number of components, including the touchscreen display, the TrackStar server, and the coil module. The graphical touchscreen user interface is designed to provide an organized workflow, capture treatment session data, and ensure the optimal treatment dose. The integrated treatment coil is the magnetic treatment coil that delivers TMS therapy to the desired brain region. The precision pulse technology results from the proprietary C-shaped iron core coil that focuses the magnetic field, allowing targeted stimulation of the area of the brain that you want to treat. Several different areas of the brain regulate mood. Neuroimaging studies of healthy and depressed patients have shown different patterns of metabolic activity of these different regions. The brain regions involved in mood regulation are connected through neuronal pathways. These neuronal circuits communicate by releasing neurotransmitters. When there is an appropriate amount of neurotransmitters within these pathways, communication between brain regions is optimal and the mood circuit functions normally. However, in depressed patients, neurotransmitters become depleted or dysfunctional, and communication between mood regions is disrupted. Increasing the amount of neurotransmitters is an established approach to treating depression. Neurons and their release of neurotransmitters can be affected either chemically or electrically. Traditionally, drugs have been used to chemically increase the amount of neurotransmitters. However, because antidepressant medications are systemic, they elicit undesirable effects in the brain and throughout the body. NeuroStar TMS takes a different approach, exploiting the fact that neurons are electrochemical cells. It uses a targeted electromagnet to produce a pattern of pulsed magnetic fields. This electric current is powerful enough to elicit an action potential in neurons, causing the release of more neurotransmitters at the synapse. In addition to these local effects, NeuroStar TMS activates deeper brain regions that lie outside the direct action of the pulsed magnetic fields. Energizing these deeper brain regions causes secondary activation of brainstem neurotransmitter centers, which stimulates other brain regions involved in mood regulation. NeuroStar TMS therapy offers a unique mechanism of action by directly depolarizing local neurons, which modulates connected deeper brain regions. This allows NeuroStar TMS therapy to affect both local and deep neural circuits, all without causing unwanted systemic side effects. A typical course of NeuroStar TMS therapy consists of daily treatment 5 days a week for 4 to 6 weeks. Each treatment session lasts 37 minutes. No anesthesia or sedation is required. At the first treatment session, the physician will start by using the treatment to perform a test to identify the patient's motor threshold. For NeuroStar TMS therapy, the motor threshold is the amount of magnetic field strength that results in a visible movement of the patient's right thumb. This test is important because it identifies the magnetic field strength that will be used in treatment. This field strength is customized for each patient to deliver the correct treatment dose. The motor threshold test will also identify the position on the patient's head in which to place the treatment coil to allow the patient to receive optimal treatment. When the physician or TMS treater begins the TMS therapy session, the device will deliver rapid pulses of the magnetic field in 30-second intervals. To the patient, this may feel like tapping on the scalp. Patients are awake and alert during the session and may return to normal activities immediately following treatment. NeuroStar TMS therapy is a proven, safe, and effective treatment option for patients with major depressive disorder who have not experienced satisfactory improvement with antidepressant medications. In a difficult-to-treat patient population, NeuroStar demonstrated consistent response and remission rates. 1 in 2 patients respond to treatment, and 1 in 3 achieve remission of depression symptoms. Not only is NeuroStar TMS therapy effective, the effects have proven to be durable. During a 6-month follow-up study, only 11% of patients experienced a relapse. 37% of these patients required reintroduction of TMS. 85% of these patients re-achieved clinical benefit. NeuroStar TMS is safe. Patients receiving NeuroStar TMS showed none of the systemic side effects associated with chemical antidepressants. The most common side effect was pain or discomfort near the treatment area. NeuroStar TMS therapy is the first FDA-cleared TMS device for the treatment of major depression. This established treatment has a proven efficacy and safety profile in treating these patients. NeuroStar TMS therapy accomplishes these effects safely, without the unwanted systemic adverse effects associated with chemical antidepressants. Several different areas of the brain regulate mood. Neuroimaging studies of healthy and depressed patients have shown different patterns of metabolic activity of these different regions. The brain regions involved in mood regulation are connected through neuronal pathways. These neuronal circuits communicate by releasing neurotransmitters. When there is an appropriate amount of neurotransmitters within these pathways, communication between brain regions is optimal, and the mood circuit functions normally. However, in depressed patients, neurotransmitters become depleted or dysfunctional, and communication between mood regions is disrupted. Increasing the amount of neurotransmitters is an established approach to treating depression. Neurons and their release of neurotransmitters can be affected either chemically or electrically. Traditionally, drugs have been used to chemically increase the amount of neurotransmitters. However, because antidepressant medications are systemic, they elicit undesirable effects in the brain and throughout the body. NeuroStar TMS takes a different approach, exploiting the fact that neurons are electrochemical cells. It uses a targeted electromagnet to produce a pattern of pulsed magnetic fields. This electric current is powerful enough to elicit an action potential in neurons, causing the release of more neurotransmitters at the synapse. In addition to these local effects, NeuroStar TMS activates deeper brain regions that lie outside the direct action of the pulsed magnetic fields. Energizing these deeper brain regions causes secondary activation of brainstem neurotransmitter centers, which stimulates other brain regions involved in mood regulation. NeuroStar TMS therapy offers a unique mechanism of action by directly depolarizing local neurons, which modulates connected deeper brain regions. This allows NeuroStar TMS therapy to affect both local and deep neural circuits, all without causing unwanted systemic side effects.
So the way I like to describe NeuroStar to my patients is describing that we're using an MRI strength magnet. That magnet is placed on the left front portion of the head. We're there to target an area of the brain that we know that's involved with mood regulation. It's called the dorsolateral prefrontal cortex.
NeuroStar TMS takes a different approach, exploiting the fact that neurons are electrochemical cells. It uses a targeted electromagnet to produce a pattern of pulsed magnetic fields. This electric current is powerful enough to elicit an action potential in neurons, causing the release of more neurotransmitters at the synapse. In addition to these local effects, NeuroStar TMS activates deeper brain regions that lie outside the direct action of the pulsed magnetic fields. Energizing these deeper brain regions causes secondary activation of brainstem neurotransmitter centers, which stimulates other brain regions involved in mood regulation.
So for me, my depression, it felt like I was in a deep, very dark hole. And no matter what kind of lifeline they gave me, I tried my best to reach on and grab hold of, and nothing seemed to work. They couldn't pull me out. It was really hard. You know, there were times when I was on a combination of 4 or 5 medications at one time. And I think at that point, my doctors felt that they had tried a cocktail of so many different types, and they were really at a loss.
And so since 2010, I've now treated over 240 individuals. And those were individuals that I had them on multiple medications, and they were still struggling with depression and or maybe side effects from the medication. And so then being able to then provide NeuroStar treatment, we've been able to get them to places that they've never been before.
I spent 60 years in the throes of depression, never knowing the real joy of life and really understanding clarity and thinking. NeuroStar therapy has given me my life, it has given me relationships, and it's given me a love that I never could have experienced before because I was so fogged.
With depression, you don't want to make friends. You just want to be alone. After the NeuroStar treatments, I've never been so engaged with my wife. At the same time, I'm there for my kids. And not only in my family, but friends. I'm a friend to people now.
I started the NeuroStar treatment, and gradually, almost every day, I felt better. I would say within 3 or 4 days, I started to feel different.
2.5 to 3 weeks into treatment, I felt kind of a lift.
At the beginning of the 5th week of the treatment, I started to see improvement. I felt like, oh, this might work.
I would say probably by the 3rd week, I felt lighter. On the way home from treatment, somebody said something and I smiled, and that was not typical for me.
It was in less than 2 weeks when I started to feel significantly different on all levels. It's like one day you wake up and it's the sun shining and it hasn't been shining. I found myself laughing at things that I hadn't found funny for a long time.
When the treatment was over after about 8 weeks, I was so excited to enjoy my life. I'd never felt like that before.
NeuroStar made me active again. I noticed that I was listening to music again. I was writing again. I was singing.
I'm so much more active after the treatments. Professionally, I've decided to pursue a promotion. I never would have done that before my NeuroStar treatments.
I feel so grateful for my health now. I'm back to gardening again. I've gotten back into my photography.
After my 6 weeks of NeuroStar treatment, I felt really good. And the most exciting part of this whole journey and this whole story was that that feeling has continued. It's not only continued, but it's gotten better and better. NeuroStar not only gave me my life back, it gave me my whole family back.
It's one more thing to add in your arsenal, along with your exercise and your therapy, and I would encourage people to choose to be happy. Choose to do something to fight the battle. Don't just say it's never going to be any better.
I feel like the whole process of NeuroStar was really simple, and my doctors truly made me feel very comfortable, very warm. Once the NeuroStar treatment was about to begin, my doctors were there with me and explained everything thoroughly and told me what to expect.
After several weeks, the patients start to recognize that this is not a fluke. By week 5, so many patients have recognized dramatic and consistent change. By week 6, they're sad to say goodbye.
I think the thing about the treatment that really appealed to me was she said that it was minimal side effects. I was on 6 different medications, and in 9 weeks, I was completely off all medication.
So when individuals are taking medications, they travel out throughout the body, and then they're more vulnerable to side effects that occur. But with the NeuroStar treatment, you don't have the risk of those systemic side effects. And this whole process will not only facilitate relief from the depression, but help facilitate remission long term.
A typical day of treatment, I come in and the technician sets me up in the NeuroStar chair and I relax. The good thing about my doctor is he explained everything to me, so I completely understood what he was doing, and I just relaxed and let him set up the equipment. And the treatment pulsates, and you hear a sound, and you feel a little bit on the side of your head, and like I said, I just relax. And next thing you know, you're out of the room and you're off to the rest of your life, doing what you want to do.
Well, after my initial series of treatments with NeuroStar, I felt very comfortable that I had a safety net, and that helps me stay incredibly high functioning. It's very satisfying to know that something works.
I had grown up very active, I was busy, I swam competitively, and I was happy. I had passions about things. Then they went away. It was like the sun wasn't shining, it was gray, cloudy. I knew something was wrong, but I also knew it wasn't supposed to be that way. I have battled depression since I was 19, and I've had great success with a lot of the medicines, but they weren't working anymore. This last 18 months, I was having trouble functioning on all levels. I saw this information on NeuroStar and I said, you know, I've got nothing to lose. They've already done the studies, they know it's safe. I can try NeuroStar, and if it works, I'm where I want to be, and if it doesn't work, then, you know, what have I lost? Within a couple weeks, I started to feel happier, and I started to feel that gray cloud that follows me when I have depression lift. And there were days when the sun was shining, and then there were more days when the sun was shining. I was happier at work, I was enjoying my life, I was interacting with my husband better, and I had the energy to pick up the phone and call my friends and see what was going on with them. NeuroStar therapy is one more thing to add in your arsenal, along with your exercise and your therapy. Don't just say it's never going to be any better. Use the resources that are out there. Choose to do something to fight the battle. There were periods where instead of working on 8 cylinders, I was working on 1 or 2. And what could I have accomplished if I'd had all of them working? The NeuroStar therapy has allowed that to happen. My name's Carol. I'm an architect. I'm a newlywed. I'm a sailor. I love my pets, and I'm no longer suffering from depression.
I'm Colleen. I'm a mom, I'm a sister, I'm a friend, I'm an active woman because I no longer suffer from depression. When I think about depression and what it is like and how to describe it, I have always felt like I was contained in a black box. I spent 60 years in the throes of depression, never knowing the real joy of life and really understanding clarity and thinking. We tried probably 36 kinds of medication, and finally my medication stopped working altogether. And I became very desperate, and at that point my doctor said, I'm bringing a new treatment into my office, and that was NeuroStar. When I had the NeuroStar treatment, it was targeted to exactly the part of my brain that was making me feel depressed, that was causing my depression. When I saw the brain scan, I was stunned. It was a pivotal point for me to understand, to bring to light that I actually had a brain disorder. It was a very comfortable treatment. I actually looked forward to going because the experience was something that was hopeful. You know, it really gave me some hope. We all deserve to have the best quality of life that we can make for ourselves. And we need to try every option possible to get there. NeuroStar is one of those options that has very few side effects, that can make a difference in a very short period of time and absolutely alter your life so that you can have a quality of life rather than living in the depths of depression. NeuroStar treatment is something that we all should be looking into.
My name is Debbie. I'm a mother, I'm a wife, I'm a writer, and I no longer suffer from depression. The best way for me to explain my illness is I kind of felt like I was in a very dark, deep hole. I suffered from depression for a total of 19 years, and that's 19 years of seeking help, of going to doctors, of taking medication, of doing everything and anything I could possibly do to get well. I felt like I had given up. I came upon NeuroStar through my current doctor. The day that I met her was a big milestone for me, and my doctors truly made me feel like what was happening was there was nothing to be ashamed of or nothing to be afraid of. NeuroStar made me think about my future in a way that I had never been able to think about it before. And all of a sudden I noticed that I was listening to music again. I was writing again. I was singing. I was just a different Debbie. NeuroStar not only gave me my life back, but I feel like it gave me my whole family back. It united us again as a whole new family and opened the door to a whole new future. It's what truly saved me and saved my life.
When I talked to my doctor about the NeuroStar treatment, a lot of the insurance companies were not covering it. I got a lot of assistance from NeuroStar and from my doctor, and after it went to external appeal, I won my case, and I got 80% reimbursement.
Things really changed in the last couple of years when insurance coverage came along and NeuroStar TMS was now available to a lot more people. It's unusual actually nowadays to find a company that's not covering it. The majority of the people coming to us, we can get covered.
Before I started treatment, I checked and NeuroStar was covered by my insurance, and I have a small copay I pay with it, and then the rest of it the insurance takes care of, and it opens the doors so I can have this treatment.
NeuroStar has a reimbursement support team that will work on your behalf and try and help you with a solution.
They've been the ones who've really pioneered getting coverage through most of these insurance companies, and they understand where it's covered and how to get it covered.
All my life, since I was 4 years old, I just loved horses. They give me a lot of comfort. I feel like they're kind of spiritual. However, when I was depressed, my husband told me one time, he said, "I know you're really, really depressed because you're not even going out there to be around your horses anymore." And that was a very dark time. I've been suffering from depression for about 45 years. I've probably been on 5 to 6 different antidepressants. And even when they did work, and there was that underlying feeling of depression, and it would never go away. I first heard about NeuroStar through a friend of mine. The treatment is nothing to be afraid of. It doesn't hurt. You sit in this wonderful spa-type chair and relax. They put a coil on your head. There's tapping sounds from the coil. I got used to it right away and actually started looking forward to my treatments. My husband, my treater, the doctor, my best friends were totally amazed when I was done. They told me that I was such a different person and that I just blossomed. It's like coming out of a shell. There are so many people that suffer from depression that can be helped by this. 5 people that I know have done the treatment, and all 5 have had great success. It makes me feel great because they come up to me and say, "You helped save my life. You sent me in this direction and I'm better." So many people could use this treatment, and we need to get the word out. Just call one of the treatment centers and just talk to the psychiatrist or doctor, and you'll be on your way. I'm Christy. I'm a wife and a mother and a real estate broker, and I no longer suffer from depression.
My name is Todd. I am a firefighter, paramedic. I'm a husband, I'm a dad, and I am no longer suffering from depression. With depression, you don't want to make friends. You just want to be alone. And it was a way of life for me. I have been seeing a psychologist for several years and not really getting anywhere. I've tried 11 different medications, which some of the side effects that I experienced were pretty severe. When I met with the psychiatrist at my first appointment for NeuroStar, we went over my history, we went over symptoms of depression, and he agreed that NeuroStar would be a good fit for me. NeuroStar treatment has helped me bring my life back. The treatments helped me with a happiness that I've never experienced before. I've never been so engaged with my wife. At the same time with my kids, I'm much more active with my family, and not only in my family, but friends. I'm a friend to people now. I spent the last 15 years as a firefighter paramedic helping others. I take a lot of pride in my profession and helping people. And it's an interesting dichotomy that I finally reached out for help myself. And with the NeuroStar treatment, it changed my life. It's very satisfying to know that something works.